West Wakefield Health and Wellbeing is one of the 20 selected out of the Prime Minister's Challenge Fund competition to provide innovative new ways of providing access to patients in GP practices.
We're trialling video consultations. We did a test last week to see how the process worked, and then tonight it's a sort of further test to see if we can streamline it any better, get further instructions and make it clearer for patients to be able to use.
You've got a very high quality picture, very good sound, so you'll pick up facial expressions, body language, the patient's overall general appearance. All of this adds up to the clinical assessment of the patients.
I see lots of patients where I do my own nurse-led clinics. The thought that I could actually do this at a distance, not necessarily cause extra stress to the patient, bringing them in, I think has great potential and great advantages really.
Consultants will be able to sit in one office and very quickly flip from site to site without having to travel and deal with many more patients and their problems and their families in their day. And the patients, of course, will have better access to the consultants, so it will be a much better experience for patients. It'll do 2 consultations in one, if you like.
We want to make sure that we can get just as much digital access for our mental health service users as our physical access service users, and they'll be able to have online access to CBT and psychological treatments with a therapist online sitting somewhere different in the UK. We think that will reduce people's waiting lists.
A key factor for us is resilience and security, and particularly, of course, because we're handling very personal data. So having looked at the solutions available, we settled on a Microsoft solution, Microsoft Lync.
Video is just one of the elements that we're doing. We're getting pharmacy support in, that you can actually take out some of that pharmacy work that GPs are doing, physiotherapists to take out some of the physiotherapy, putting in self-care and the care navigation process that we've built to really properly map the directory of services that are available. We firmly believe that we'll be able to save some consultation time that GPs can reinvest. We're operational clinical managers. We know how the NHS works, and partnership between Modality and Microsoft and ourselves and the Health Information Service has been pretty much a dream team so far.
The platform that we've put in is a Microsoft Foundation technology, Skype for Business, which can grow with the growing demand of the client's needs. And because it's a solution that works across any platform and any technology, whatever the end user device is, the platform and the solution will work.
We'll be starting live pre-bookable video consultations beginning of January 2015.
We've got a really clear vision. We know exactly how we want to fix the system. We're fixing it for us, for our future, for our children and for the local community. We feel driven.